I want my baby. She's doing good, Mom. They're just cutting the umbilical cord.
Okay.
I want my baby off.
Just gonna dry the baby off, okay? Suction. Okay, I'm gonna go ahead and hand baby under the drape.
Oh, don't hand baby under the drape. Mom's chest isn't sterile, and we don't want that drape to come back in and mess up the surgical field.
Okay.
Dad, would you mind
All
stepping
right.
on the other side? I'm gonna go ahead and get in here. I'll make some room because it's a little bit crowded. All right. I just want to see my baby. I know, Mom. Let's get you all ready here.
Temperature's only 97.
Okay. We're almost done. We're just moving a few things.
I think baby's temp is dropping. He's crying.
We can bring baby to you.
Okay, it's taking too long. I'm just gonna bring baby to the warmer.
Okay, no problem. Okay, Mom, so we don't want baby's temperature to drop too far. So we're going to take baby to the warmer, and Hannah's going to finish assessing your baby there. And then we're going to finish sewing you up and get you into the post-op area, and we'll bring baby to you then, okay? You can hold baby as long as you want then. You can breastfeed and do all that good stuff then too, okay?
I'm in so much pain. I just want to see my baby.
On a scale of 0 to 10, how would you rate your pain?
A 10. It's throbbing, and there's so much pressure, and I just want my baby on my chest.
Okay, we'll bring baby to you soon, okay? As soon as we can.
I just want my baby.
Look who's here. I've got your baby girl. Would you like to hold your baby?
No, just give
No?
it to him.
Oh, okay. Okay, I guess we'll give it to you, Dad.
You get to be the lucky one to hold your little baby girl.
Yeah.
Mom, in your care plan it says that you wanted to breastfeed. Is that still your plan?
No, just give it a bottle. Just give it some formula.
Okay, well, I guess I'll go get some formula and I'll just make a note in your chart.
Is there anything else we can get you before we go? Okay, well, we'll give you some time with baby, some time to get adjusted, and we'll bring that bottle right back, okay? All right.
Well, that didn't go well.
No, it didn't go well at all.
Yeah.
I feel like our C-section patients have so much problems bonding with their newborn and with breastfeeding.
Yeah, I mean, I wonder how we could make it more similar to a vaginal birth.
Exactly. Things go so much better then.
Yeah.
Why don't we look into it and see what we can find and get back to the charge nurse?
That sounds good. Let's do that.
Let's do it.
Oh, wow, your hair's different.
You dyed it.
It looks good, though. I
Yeah.
like it.
It's good to have a change.
Yeah.
Did it myself.
Good job.
Yeah, but anyways, so the reason we're here, we noticed that the cesarean sections aren't having very good outcomes. Babies' temperatures kept dropping, they kept crying, increased stress levels. It just didn't seem to be going very well.
Yeah, not for Mom either. Mom was really stressed out. Her pain level was more out of control. Her plan was to breastfeed, and afterwards she wasn't interested in breastfeeding anymore. We brought baby in, and we were really excited to show her baby and let her hold baby, but she didn't want to, so she gave the baby to a family member instead, or had us do that. It just seemed really discouraged. But we did some research. We wanted to figure out how to make this better.
We actually found out in our research that skin-to-skin contact immediately after a cesarean section, it increases chances of mom breastfeeding, it decreases mom's perception of pain, and it stabilizes baby's temperature.
And it's a lot better for mom too. Mom and baby bond a lot better. And there was this one hospital that did a really interesting study. They looked at the number of babies born by cesarean section that were transferred to the NICU for observation after delivery. And when they did immediate skin-to-skin contact, the number decreased. So it seems like it's better for mom, better for baby, just all around good outcome. What do you think about this?
There are a lot of barriers, like the cost associated with it all, the education of all the staff, and also the moving of all the equipment that's in the room.
Yeah.
But I have been thinking about this myself.
No way, you made a
And
poster.
I have written a list. In order to make this happen, what we need to do is write a protocol collaboratively with all staff. Educate all the staff. Before delivery, we discuss potential with mom and educate her and her support people. We confirm with mom if she wants skin to skin and where, in the OR, in recovery, or on the ward. Then we have one nurse for mom and one nurse for baby. We then determine if the equipment OR needs to be moved. And Make sure mom's gown is undone and arms removed from her sleeves. After delivery, we make sure the newborn is responding appropriately. And if it is, place newborn in transverse position on mom's chest. Next, we're going to dry the newborn and cover the newborn with a warm blanket. Then we do APGAR scores and our assessments while the baby is on mom's chest. And we continuously assess the newborn for a patent airway. We make sure the nares are not flaring, the heart rate is stable, and the baby is centrally pink. How does that sound, girls?
Sounds great.
That's amazing.
Yeah.
You put a lot of thought into this.
Yeah, high five.
Yes.
Good job.
All right, let's do this.
Y'all pull. It's a girl. I'm going to delay the clamping. Okay, I'm just going to dry them off.
We're doing skin to skin?
Yes.
All right, we're going to do skin to skin.
Skin to skin.
Yep, mom's chest is sterile, so go ahead and put baby under the drape.
Okay. Packing baby
All
under.
right, mom, baby's coming. Here we go. Aww, she's so beautiful. Aww. Congratulations, Mom. Hannah's going to be doing a few assessments on baby. How are you feeling right now?
So good. I'm just so happy to have my baby.
Good. Your vital signs are stable. Baby's doing great. Aww.
We got a temperature of 98. That's good.
Perfect. Aww.
So go ahead and take a listen.
Your plan is still to breastfeed, right, Mom?
Yes, I've always wanted to breastfeed.
Oh, perfect. Okay. Well, you're going to hold baby for an hour, okay? Or until after your first breastfeeding is done.
Okay, baby sounds good. APGAR of 8. It's nice
Perfect.
and stable, okay?
Awesome. On a scale of 0 to 10, how much pain are you in, Mom?
No pain at all. I'm just enjoying every moment of this.
Oh, good. So glad about that. We're just going to finish a few things back here. We're going to keep an eye on your vital signs. You keep holding baby and loving on baby. Then we're going to take you to your recovery room afterwards, okay?
Thank you.
All right. You're welcome.
Brandon Gilnew is about to deliver her second child through a scheduled, medically necessary C-section. While thousands of C-sections are done every year, Brandon will be only the second mother at Sunnybrook to do so using a new technique called skin-on-skin C-section. Traditionally, babies are taken away from the mother to be cleaned and given routine care.
Push, mommy, push.
But this new technique tries to mimic vaginal birth by asking Brandon to push, involving her more in the process. And as soon as little James is born, he's placed on Brandon's abdomen and then passed through the surgical drape to her bare chest for skin-on-skin contact. After a brief cry, James quickly falls asleep on his mother. Dr. John Barrett is leading this initiative at Sunnybrook and says the physical connection starts right away.
Thank you, Dr. Barrett.
And so do the benefits of skin-on-skin contact, including increased bonding, improved breastfeeding, and preserving baby's temperature and blood sugar. Also, the umbilical cord is left unclamped for longer, which improves baby's blood flow and breathing.
So there's actually medical evidence that skin-to-skin contact is better for the baby and the mum, as well as as soon as you've done a few of these, you can sense immediately that it's a different procedure. It feels much less medical.
Dr. Ambika Aneja delivered James and says Brandon's doula had asked about this procedure.
As a mom myself, having had 2 previous cesarean sections, I think it would have been great if the procedure can be performed without compromising the health and safety of mom and baby.
Special precautions are taken to minimize the risk of infection, like sterilizing the mother's chest and having a sterile handoff by the mother's head.
He's very content.
Brandon and her husband Brett, who was also ready to do skin-on-skin if Brandon was medically unable, says skin-on-skin C-section should be a standard option.
It was amazing. It was a really amazing experience to be able to have a C-section and also have your baby come right on top of you and transition into the world in such a peaceful way.
It was so great to be able to be involved in the whole process, to help transition our little one into the world. He was put on my wife's chest so quickly, and then there's the three of us there together as a family, keeping him calm and happy.
Sunnybrook is now studying skin-on-skin C-section and the effects on mother and baby for the first time in Canada.
You know, cesarean section rates now are between 25 and 30% of all births. So if we're delivering 1/3 of our babies by a cesarean, we should look at ways to see if we can mimic the normal process.
With Sunnyview, I'm Monica Mattis.
Scalpel. But I have been thinking about this myself.
No way, you made a poster.
And I have written a list of things that we're gonna need.
You're trying to get water.
Whenever you're ready.
Okay. So in order to make this happen, what we need to do is... Ow! That was perfect.
He's laughing at me.
Oh, geez.
I just need to read it.